Good morning. Today we will see the remaining portions of give reasons of medical surgical nursing. So the first one is pre-medication before painful procedures. Why we have to give pre-medication before we do a painful procedure? Prior to any painful procedures, patient experience high degree of stress and internal tension. So preoperative drug administration or pre-medication, otherwise we call it as a pre-medication, which is intended to reduce these stresses through anxiolytic and sedative effect. The second one is hair wash before EEG. So why we have to ask the patient as if they have to do the hair wash before doing electroencephalogram. Electroencephalogram EEG or EEG is a test that measures electrical activity in the brain using small metal disc, otherwise known as electrodes, attached to the scalp. So hair must be clean, dry hair with no added oils, gels, hairspray or any other fixative, and no weaves, wraps, braids or other attached hair pieces, because these hair products can make it harder for the sticky patches that hold the electrodes to adhere the scalp. So if we are not washing the hair and if there is a lot of oil or gel or hairspray in the hair, that will not allow these electrodes to attach the scalp, and that will cause an EEG will be unclear, not clear, or we won't get the desired effect of that particular EEG. That is why we advise the patient to have a hair wash before we do go for a EEG. Full bladder for ultrasound abdomen. We usually hear this one means the patient has to drink a lot of water before they have to come for a ultrasound abdomen. So what's the reason for that? Ultrasound equipment generate and receive sound waves. Ultrasound waves are a very high frequency that can be heard by the human ear. Sound energy can be reflected and giving an echo as a result, or it can be refracted leading to a change in the transmission path. Sound waves which are reflected or bounced back or echoed are very important in ultrasound examination. We rely on the echo to make a diagnosis, this echo. So a full bladder helps the sonographer in several ways. The first one, the sound transmitted through the bladder result in more sound energy at the target organs like the fetus, cervix, uterus or ovaries, etc. This result a good echoes and better, more crisp image on display, as the round trip of the sound energy has little resistance to the transmission. Secondly, air is a very strong ultrasound beam reflector. Bowel tends to fill with intestinal content and gas. A full bladder helps by pushing the bowel out of the pelvis, allowing the transmission of ultrasound to the target organ. And most women have an anteverted or title towards uterus, which unfortunately in some cases doesn't present an ideal angle to sound transmission pathway. A full bladder tilts the womb backwards, hence presenting a more favorable angle to be transmitted sound energy, which result in a better image. These are the three reasons why we should have asked the patient to have a full bladder before an ultrasound of abdomen. At least you write one or two reasons will be enough for you to get the full mark. Next, strict monitoring of prothrombin time is done in patients on anticoagulants. The prothrombin time, sometimes referred as PT or pro time test, is a test to evaluate the blood clotting. Prothrombin is a protein produced by the liver, and it is one of the many factors in the blood that helps the clot appropriately. Direct oral anticoagulants have been associated with prolongation of prothrombin time and international normalized INR. Anticoagulants are the drugs which helps to prevent the blood clotting if we have some particular clotting disorders, or we have any prosthetic heart valve or any other disease. The patient will be on anticoagulants. So when they take the anticoagulants, automatically the clotting time will be prolonged. So, proper monitoring of this prothrombin time allow the medication adjustment and prevention of adverse effect like bleeding. Next is erythropoietin given in chronic renal failure. Erythropoietin is a glycoprotein hormone naturally produced by the peritubular cells of the kidney that stimulate red cell production from the bone marrow. So, patient who is having a CKD, a chronic kidney disease, the erythropoietin production will be decreased or stopped, and this will lead to anemia, because in the end It means when there is no more erythropoietin, erythropoietin is one of the essential factors of the RBC production. So that one factor is missing, the production of the RBC, the hemoglobin will not be completed. That is why the patient who are having CKD will be given erythropoietin artificially. So manufactured erythropoietin or exogenous erythropoietin improves the anemia caused by chronic renal disease and helps the people who are in the dialysis. Site of snake bite should not be elevated before the heart level. Positioning the extremity below or at the level of the heart in snake bite with severe and potentially fatal systemic toxicity. The systemic toxicity might be delayed by positioning the extremity below the heart to avoid increased systemic absorption of the venom. Next is insulin is not administered orally. Insulin is made up of peptides. It cannot be taken orally as the digestive enzymes of the stomach degrade it and we will not get the desired effect of the insulin. So it loses its function. That is why insulin is not administered orally. Stool stiffness used in patients with MI or myocardial infarction. Heart attack or acute MI occurs when one of the arteries that supplies the heart muscle become blocked. Blockage may be caused by spasm of the artery or by atherosclerosis with acute clot formation. Strain at the stool causes blood pressure to rise, which can trigger the cardiovascular events such as congestive heart failure, arrhythmia, acute coronary disease, and even aortic dissection. So, to prevent constipation, stool softeners are used in patients with myocardial infarction. Thank you. Thank you for listening.